Professor, the first question I would like to ask, what is the place of psychology for Muslims? Do we need psychology? I mean, as a Muslim, maybe we don't need, or do we need?
Yeah. I think that there is no nation today that can avoid making use of psychology in its development, its economic development, its medical development, in all facets of life, political, whatever. Psychology, as the study of human behavior and thought, finds itself entangled in anywhere there is human activity. And that is why we have so many branches of psychology: educational psychology, abnormal psychology, clinical psychology, social psychology, cross-cultural psychology. So whatever we do, there is an element in our behavior that needs to make use of the contributions of people who study human behavior.
Sir, you said psychology is covering all aspects of human life.
Yes.
Also, religion is covering all aspects of religion. Islam,
yes,
is also covering all aspects of life. So can we say psychology is a little bit sometimes put against religion?
Yes.
Please.
No, we cannot say that it is against religion, but we can say that psychology itself is not like any other subject, in the sense that it has one leg in pure sciences and one leg in the arts, and it is guided by a philosophy and a worldview of Western civilization. So, in this case, we can say that psychology is not one subject like we talk about history or we talk about geography. It is an area where it is influenced by the worldview of the culture in which it developed. Our old Muslim scholars have been doing psychology, but they did not call it psychology at the time because there was no psychology. For example, the main branch of psychology on which every branch learns from, takes part from, is psychology of learning. We find that Abu Hamid al-Ghazali spoke in detail about learning. We find that Abu Zayd al-Balkhi, about 12 centuries ago, has actually developed a whole system of behavior therapy, of treatment by changing the thought of the person, cognitive psychology, and by changing the behavior. So the issue here is that we need to see where psychology is influenced by the worldview and the philosophy of the West, where it goes against our thought, and this is part of it. We see where it comes under pure science, and we accept it and give it our own worldview.
Sir, you said Abu Zayd Balkhi developed cognitive therapy.
Yes.
Can you a little bit, develop this subject?
Yes. Abu Zayd al-Balkhi, 12th century ago, he was a physician, he was a philosopher, he was a geographer. He became very well known in the field of geography. And he was a man of letters. He writes beautifully and is well known for his inimitable style. Now Abu Zayd al-Balkhi wrote a manuscript. The book that he wrote is called Sustenance of Body and Soul. مصالح الأنفس الأبدان والأنفس. And this manuscript stayed for 12 centuries in it's only here in Turkey that it was kept. In the Hagia Sophia Museum here, a great Turkish scholar by the name of Fuad Siskin was able to come and to make a copy of this great manuscript. In this manuscript, Abu Zayd al-Balkhi speaks about the most modern psychological methods of treatment, psychotherapy, that we know now. It is only in the 20th century that people have come up with cognitive behavior therapy. This is what al-Balkhi started with, that all emotional disorders start by negative thinking. If we think wrongly, then we are going to develop wrong emotions.
So
Yes.
now you said the disorders of behavior is caused because of disorders in thinking.
Yes.
So how does he therapy thinking disorders?
Yeah. His therapy depends on helping the person to change his thought. And he not only suggested how a person can change his thought. For example, he says many people, because he spoke about 4 different kinds of emotional disorders. These are fear and anxiety, and then sadness and depression, and obsession, waswasa, and anger. 4. And he showed how you can get rid of disorders that are related to these 4 neurotic disorders. For example, in fear, phobia, he says if the person who has a phobia faces the object of which he is afraid of, instead of running away will make him more afraid. But facing it, he will discover that the thing he is afraid of, he should not be afraid of anyway. For example, he gave a good example. He said, if a Bedouin Arab is suddenly taken to Europe and he sees the fog for the first time in his life, he will be afraid to get into it. He will think it is something solid. But if he walks into it, he will discover only this is humid air, and he will lose his fear. He said most of the fears that people have are of this type.
So we talk about fear,
Yeah.
phobias.
Yes.
Now you said the second one, depression.
Yeah, for depression, he is the first ever to differentiate between what we used to call psychotic depression and neurotic or reactive depression and normal depression or normal sadness. So it is only at about the end of the 19th century and the beginning of the 20th century that a psychiatrist by the name of Kraepelin was the first to speak about endogenous disorders, endogenous depression that comes from within. Al-Balkhi, through his own clinical observations, he came up with this 12 centuries ago. He said there are 3 types of depression and sadness. The first form is the normal kind of sadness. All of us normal people will be sad from time to time. We have certain problems. And this is not an illness. He said if a person loses all his money in the bank, or somebody whom he loves dies, he becomes depressed. And this is a depression in which there is a clear-cut reason for it. And he says this is the one that I can help by changing the thought of the depressed person. But there is a third type of depression, he said, which is caused by humors in the body. At that time, he was not talking about neurotransmitters or things that we have discovered now. But they used to call it humors. So he says this is a sudden depression for which there is no obvious reason. And this is what we call today in psychiatry major depression. And he said this kind of major depression will not easily be treated with changing the thought. This requires medical intervention. Imagine that he said this material at that time.
So now the third one, obsession?
Yeah.
Yes.
The strange thing is that he spoke about this obsession, al-waswasa, and he considered it the most difficult disorder to treat, which goes along with our modern psychiatric and psychological thinking. Not only this, but he said that this kind of disorder in which the person feels himself compelled to repeat certain thoughts or to repeat certain actions like washing hands again and again. So now we call it obsessive-compulsive disorder. He gave a number of suggestions in its treatment. And one of the suggestions which I did not find in any book of psychology or psychiatry is that don't stay alone. And this is very important because the person afflicted with obsessive-compulsive disorder, if he's alone, lonely, this will become the ruminations and the repetitions. It will dominate his thought. So he said the best thing is all the time to have a friend around. Also, he should have a number of activities. And these activities he should not indulge in one for a long time. He does something and then before he's bored, he goes to the other and so on. And he, in this sense, I find that this is not found in any Western book because it is not possible in the Western world today for a person to leave his job and come and stay all the time with a friend who has an obsessive-compulsive disorder. But I discovered that if this is done in this manner, indeed it is very helpful to have someone, a friend, to be with him all the time. He also suggested a number of aspects, and it is this disorder in which he spoke about also the spiritual element in it. And in fact, I have learned in my own psychotherapeutic work, I have learned from al-Balkhi and tried to apply it on my own patients. I have been with Professor Dr. Mayer in England, in the Middlesex, where he came up with the most modern way of treatment of obsessive compulsive disorder, in which he will bring the person and prevent him from, for example, if he has this compulsion of washing his hands, he will put him in a room where there is no water and force him to stay. And then after he gets a little bit better, then he puts dirt in his hands and do not allow him to wash. And by so doing, the person becomes very anxious, but eventually he will improve. Now this, I think, al-Balkhi spoke in a different manner, but actually following the same technique. I have translated the whole manuscript to English, and it was published in London. Then a Norwegian psychiatrist, he is one of the of those running the Norwegian psychiatric the Norwegian Association of Cognitive Behavior Therapy. He read my manuscript in English, and he told me that this will change the history of psychology. Then he invited me to Oslo, to their annual conference, to tell them about al-Balkhi. I did so. Not only this, but he translated the whole manuscript to Norwegian and published it in a book. He took permission from my publishers in London. This, to me, I will just say very quickly that it is very important for us psychologists of today to look at the works of our early Muslim scholars in order to blend it with modern psychotherapeutic and psychiatric methods.
Sir, we have so far talked about fear, obsession, waswasa.
Yes.
And what about anger, ghadab,
Yes.
which is a big
Ghadab.
problem today.
Yes.
And there are so many psychologists trying to handle this problem.
Yes.
What was Abu Zayd al-Balkhi's solution to this?
Yes. Yeah, Abu Zayd al-Balkhi, in tackling anger, he says we need to change the thought of the person. And in this sense, generally anger is related to arrogance in some way. Generally, if a person has been angered somebody who is of his own level or who is less than him, does something which make him angry, then he will become very angry. But if the person is higher than him, it is his boss, then if he did something which should make him angry, instead of being angry, he will be afraid. This is the boss of the company. He may fire me. So he's afraid, you see, though he is saying to him things that can make him angry. But if one of his own colleagues says something which makes him feel disturbed, he will be very angry. Now he begins to say to the person who is angry to rethink about himself. Why is he angry? And then he advises that he should put himself in the boots of the person who made him angry. Why did he do what he did? And in this sense, he is actually talking like a counselor in accepting the other person, seeing the motivation for whatever he does. Not only this, but he advises the following. One of the tactics is not to see the person. If you are angry with somebody, then you should, after looking at yourself why you are angry, even blaming yourself, seeing the motivation of the person, also don't see the person. Keep him out of sight for some time. And then the person should begin to think whether he himself had done some of the things that made him angry or not. For example, if this person was supposed, he told him to do certain things and he didn't do it on time, and he is angry, then he should ask himself, throughout his life, didn't he do, wasn't he late in doing things for no good reason? And definitely he will find. And in this sense, he begins to gradually change his thought. Not only this, but he should think about his own relationship with Allah. Hasn't he done anything that Allah told him not to do or not? Now, if I did not obey Allah and did things which Allah told me not to do, how can I be angry from another human who did not do the things I want him to do?
Very good.
So in this sense, he comes here and there in different ways to change the thought of the angry person. And this indeed is the best cognitive therapy that one can think of. I applied this in my own practice.
Sir, I summarized as an example of Islamic psychology. What could Islamic psychology achieve in modern world today? As just a little pieces of, of course, your whole research, how to treat fear, obsession, sadness, as well as anger, which are the major problems of the modern world today.
Yes.
But just few questions more. Well, I know you are trying to Islamicize psychology.
Yeah.
Some of the dangers of psychology you have mentioned in your books.
Yeah.
How can we Islamicize psychology? What is your perspective and advice for us?
Yeah. I think the most important thing is first to psychology now, even in the West, is going through transformation. Now, psychoanalysis of Freud, which is in many ways opposed to Islamic thought, and his exaggeration in talking about unconscious sexual motivation, that man from the time he is born until he goes to his grave is motivated with a libido which is supposed to be of a sexual form. All this nonsense, unfortunately, there are a number of Muslim psychologists today, particularly in North Africa, in Algeria and Morocco, who still cling to thoughts that the Western world has already started to get rid of. In some universities in England, they no more teach Freudian psychoanalysis as a form of therapy. They only teach it to students as history of psychology. We need, as Muslims, to see where psychology itself is heading. Now there is this revolution of positive psychology. That Western psychology has wrongly associated itself with medicine. And actually, it should have concentrated on its role as a method of counseling, of helping the person who has a problem to solve his problem by learning. Just as you learn anything, you will learn to become psychologically ill. And so you unlearn. So in this sense, we need to relook at psychology itself and see the areas which are more suited to our beliefs and also to our culture. Because Western psychology is based on Western culture. I will give you a quick, clear example. I know of a patient. She is a woman who developed serious feelings of guilt and disturbance and illness because her husband took another wife. She began to feel certain psychological difficulties, and she said that the other woman has made witchcraft against her, sihr. So she goes to this. She's in England. She goes to this British psychiatrist and tells him the new young wife of my husband has made sihr to me and made me sick and made me. So at once he wrote, she is suffering from schizophrenia. She's mad. And he gave her very strong tranquilizers. Now, when this woman went to a Muslim psychiatrist, after going through swallowing tablets that made her sicker, he discovered that she is normal. This is normal thought in her culture. She is not mentally sick. This is only an example. There are many examples in psychological disorders. For example, I have a patient who saw a dream of his mother who died, and she came in the dream and told him certain things. You are going to join me after your cousin dies. It will be your turn. He became sick. He developed a phobia of death. Now, psychiatrists in the hospital where I was working, they gave him tablets. They considered him depressed. And he did not make any use of their therapy. They even suggested to give him electroconvulsive therapy, electric shock in the brain. Then when he came and we started to speak about his problem, and we talked about it within the Islamic framework, when did she tell you will join her? You are afraid because she said your cousin perished and your cousin died in a car accident. It doesn't mean that when you are next, maybe you are next after 60 years, after 70 years, you don't know. She is in another world where time and space are different. Then I will put him in relaxation. He will imagine himself going to in front of the Kaaba, the grave of the Prophet, to relax. And then we speak about death itself. What does it mean? The man improved so much that in a short time he was able to go to the graveyard to bury somebody, the grandmother of a relative, and he told me, I changed. Now here it is. Now we are using our Islamic approach. We are using the culture in order to help the person. But if you read a book on psychiatry from the West or a book on psychology and just try to apply it without thinking, you will not be of much help to the...
Sir, I thank you very much. But lastly, I would like to talk about your association that you have established in the United States, and what are the main objectives of your association of Muslim psychology? If I am not wrong.
Islamic psychology.
Islamic psychology, yes. So maybe some of our listeners could benefit or
Yes.
contribute to your endeavor.
Yeah. Yes, this is an association of Islamic psychology. And now Islamic psychology, people in the West, a number of psychologists and psychiatrists are beginning to appreciate that people who are Muslim have a different worldview and different culture and need a different kind of treatment. So, in this sense, we need to make a well-organized association in which Muslim psychologists would come together, will develop curricula for universities that can change the purely Western method of teaching psychology, of improving the methods of treatment, improving the methods of utilizing psychology, even in other fields like industry, like in education. So, in this sense, we have established this with the help of a British professor of clinical psychology. His name is Rashid Skinner. Skinner is a British professor of psychology who converted to Islam. And he is teaching a course in Islamic psychology in Cambridge now for a number of years. So now he is going to come to Zion University together with an American also psychologist, counselor, who has also converted to Islam. And the three of us have come together to develop this association. Inshallah, we are hoping that in Zion University will become a center for this approach in psychology. We are having our conference in October, in which we have invited people who are of very high quality, like this professor of positive psychology, Seligman. He's coming.
Martin Seligman.
Martin Seligman. And also we have invited Muslim scholars like Hamza Yusuf. He will also be coming. So this will be like an inaugural conference for the establishment of our association. We hope very much that this association is going to have its effect, inshallah. The issue here is that Western psychologists, whether they convert to Islam or not, are more understanding in seeing these differences in. But unfortunately, I find a number of Muslim psychologists in the Muslim world who cling to Western psychology without change. They are more royal than the king. They are more attached to a model which is being outmoded in the West. So indeed, we need to educate them. We need to let them come back to their roots.